had to make the decision at that point that I needed to do something else with my life.
Jeff left the slopes behind, but over the years, his arthritis pain worsened and started to interfere with his family life.
I've never really taken my kids skiing. I tried once, and that was another very depressing time in my life, because what would happen is we'd come down one run and my knees hurt so bad I could hardly stand up on them, and my daughter's saying, "Please, Dad, just one more run." And that was just very depressing, and I want to be able to do the whole experience with my kids before they move out.
After trying every option available to relieve his knee pain, Jeff decided to undergo the most invasive of arthritis remedies, total knee replacement surgery. And I'm going along for the ride.
The arthritis.
What are these screws in here?
It's the morning of Jeff's surgery. First stop, pre-op with Jeff's doctor, orthopedic surgeon Joseph Ferrone.
Now, where exactly is his arthritis?
His arthritis is seen here when you look at an x-ray and you see the lack of a space between the two bones, between the femur and the tibia. There's very little space here. Bone is hitting bone. That's the essence of an arthritic appearing knee by x-ray.
And what are you going to do to fix that?
Well, what we're doing today is a knee replacement, total knee replacement. And interestingly enough, he's had a similar procedure done, had that very same procedure done on the left knee about 9 months ago. And these are the x-rays from that knee. And you can kind of get a little image of what this looks like when it's all done.
It's 7:30 a.m. Countdown to surgery is 60 minutes.
Well, it's about time to go.
The surgery will take about 3.5 hours. Most patients opt for a general anesthetic and sleep through the operation. But Jeff, already a veteran of knee replacement surgery, has chosen to receive a local anesthetic, meaning he'll be conscious the entire time. Every year, almost 400,000 Americans have either hip or knee replacement surgery due to osteoarthritis.
How long will it take you to get to the bone?
Oh, about 15 minutes.
You're looking at an exposed knee joint.
That's the femur.
First, Dr. Ferrone exposes the bones of the joint and starts fitting the replacement.
And this is a template that is made to correspond to the size that we think we're going to use based on the x-ray and based on the other knee. And that seems to fit quite well.
Next, Dr. Ferrone drills holes into the upper and lower leg bones where the replacement knee will be inserted like a plug in a socket. Then, he saws down the bone so that it is smooth enough for the replacement knee to fit tightly. Finally, he sizes the bone.
This is a good test of, there it goes.
To make sure the prosthetic will be a perfect fit.
So how's the operation going down the way you're looking at it?
Looks good to me. It's actually really interesting.
It feels really interesting.
What I see here now.
Jeff is pain-free and oblivious to it all.
Your knee's completely open.
Yeah.
And like I can see, like the top bone here is completely exposed. Your kneecap's actually over on this side. And they just cut away the top of this bottom bone down here. They just sawed it off and actually like took it out. It's sitting on a plate over there. And so right now they're smoothing it out. That's what this is.
So what you're telling me is it's too late to back out now.
It's a little late.
Okay, I just wanted to make sure I knew that.
And after another hour of sizing and aligning and sawing and fitting,
So he comes out pretty close to straight there.
the knee is finally prepared, and it's time to put the new prosthetic knee in. The prosthesis is made out of metal and a plastic called polyethylene. It consists of 3 main pieces called the tibial component, the femoral component, and the patella. First, Dr. Ferrone inserts the tibial component that attaches to the lower leg bone. Dr. Ferrone actually uses a hammer to secure the prosthesis. Orthopedic surgeons are often referred to as the carpenters of medicine.
So this can rotate all over the place. Now, if the knee rotates, it'll rotate here, not between the metal and the bone, okay?
So no wearing on the bone.
No wearing, no loosening against the bone. We want this thing to be tight as a filling in a tooth, you know, never move.
Next, he fits the femoral component, which attaches to the upper leg bone.
good to work out before these cases.
All of the hammering is to make sure that the prosthetic knee remains in place. This particular prosthesis is unique in that no cementing is necessary. The undersurface of all three parts which attach to the bone are porous, so the bone will actually grow into them. All that's needed is a tight fit.
Okay, let's have the patella.
Finally, Dr. Ferrone puts in the prosthetic kneecap, or patella.
The polyethylene rotates to accommodate the rotation of the patella. So this goes pressed on here. The final implant is in. The patellar implant was the last one to be placed.
Remarkably, this surgery of hammering, sawing, and drilling has given Jeff back the flexibility he once had.
Great, so that's knee replacement surgery.
That is it.
That's a wrap, and I'll be ready to hit the slopes.
5 months after Jeff's knee replacement surgery, he is well on the road to full recovery.
That's the knee. That's about 5 months ago. It isn't completely healed. It's a continuing process. I suspect it's probably going to take a full year before it's completely back to full strength, as if I had a complete knee in there. But as you can see, it's working pretty well now after only 5 months. So I'm pleased so far.
To maintain a healthy lifestyle, exercise is almost always important. But for some osteoarthritis sufferers, many types of exercise are impossible and sometimes even dangerous. There is one kind of exercise that seems to be making some waves. Water exercise. Twice a week, instructor Kim Barrows leads a class of arthritis sufferers through 45 minutes of exercises to build up strength in their joints.
On a bad day, when I first get out of bed in the morning, my arthritis, my legs and knees are quite stiff, my shoulders are stiff, and getting over here into this water and doing these specific exercises helps.
Water exercises don't cause much pain because water makes you buoyant and decreases the impact on your joints when you move. It's as if a 150-pound person weighs only 50 pounds in the pool. This kind of exercise not only helps arthritis patients diminish their pain, but increases their range of motion and flexibility. While it doesn't cure their arthritic joints, the rigorous movement in the pool has all the benefits of a regular workout with much less wear and tear.
I've had severe arthritis of the hips for, I'd say, the past 3.5 years. And when I found the water exercise class here, what I found was that you don't have to find that arthritis is living life as an endurance contest. Instead, I think you feel that you are in control.
They have decreased pain when they come. They find when they don't come for a week that they really miss it, they have more pain. Everyone loves coming to the class.
This program has been absolutely phenomenal, and I've had probably in this last, I'm going to say, 4-month period, a range of motion. Overall, the doctor's been extremely pleased.
I find that it's as good for the spirit as it is for the joints.
To find a water exercise class near you, contact your local chapter of the Arthritis Foundation. "17-year-old Anna Lagazi has endured more illnesses in the past 6 years than most of us will ever withstand in our lifetime. Anna's ordeal began when she was 9 years old, when she suffered flu-like symptoms, achiness, nausea, and high fevers. Anna's parents took her to see several doctors, yet for over a year, her illness remained a mystery.
How is the morning stiffness doing?
Because of the way that I presented my symptoms, we started thinking, oh my God, this could be leukemia, this could be cancer. And all I'm thinking is, wow, I really want to be around for my prom someday.
After months of medical testing, doctors finally discovered that Anna was one of the over 70,000 American children afflicted with juvenile rheumatoid arthritis.
When they said arthritis, I would have done a back handspring if I could have, because I really thought that this is going to be like this big walk in the park, and woo, it's not leukemia, so it's going to be easy and no problem. And it wasn't until probably a few months later that I realized like what a trip we were in for.
No one knows why it starts, but rheumatoid arthritis begins with a malfunction in the immune system. White blood cells normally attack foreign invaders like viruses and bacteria. But for reasons not entirely understood, they can also target our own healthy ligaments, tendons, and cartilage, especially in the joints. As the joints are attacked, the synovium becomes inflamed and releases enzymes. These enzymes then eat away at the joint, causing incredible pain.
Rheumatoid arthritis is a condition which is quite different from osteoarthritis. It's a systemic disease that affects many body systems, but has a particular predilection for joints.
But the white blood cells don't just target the tissue in the joints. They set siege throughout the entire body, including the heart. At age 12, the pericardium, or covering around Anna's heart, fell prey to her disease, and she nearly died.
I really felt like someone was trying to rip my heart out of my chest, and what it basically led to the ER at Norwood emergency room, and then they shipped me to Children's Hospital, and was there for a while just trying to get some of the weight back on and get the heart under control. It was pretty scary stuff to realize how close we came to saying bye.
For the next 3 years, Anna was in and out of the hospital. The disease was devastating her body.
My worst days is like that brain crunching, I don't want to move, don't talk to me, don't look at me, no sudden movements, just turn out the lights, let me alone for a long time. And those are the days that I don't go to school, I don't get out of bed.
At age 14, Anna's hips had degenerated so badly that she had both replaced with prosthetics. The rehabilitation took months. Finally, at the age of 15, doctors were able to find the right balance of medications, and Anna was able to get some control over her symptoms with drugs.
And now the knee towards your chest.
Taking medication has just been like built into my routine, like these past, I guess it's like close to 6 years now, that I don't even think of it. And even if it's 35 pills, I don't even think of it. I just get up and I line out the bottles and I take them, because I know if I don't take them, I'm going to be one hurtin' pup later on.
Anna's drug regimen has been an enormous help in regulating her pain. But many of the medications have had harsh side effects. The most severe was the stunting of her growth. Because of the high doses of steroids Anna took during her early adolescence, she is only 5 feet tall and weighs just 100 pounds. The steroids have stopped her severe pain, but they have also stopped her growth. But this diminutive 17-year-old hasn't let her disease prevent her from having as full a life as she can, spending time with friends, and even performing in the school play. And in the spring of 2000, she lived out her dream of going to the prom.
We went to the prom. We had a great time. I took one of my best friends. It was simple. We had so much fun. I danced. I love dancing. I always have.
Unfortunately, dancing the night away put too much strain on her joints, and she paid the price dearly.
We all slept over a friend's house, and everybody gets up the next day and they want their coffee, and I wanted a morphine pump. Like, I really thought I was going to die, and it was